So I'm Etta Watts. I am the fundraiser for our Student Society of Veterinary Surgery with the College of Veterinary Medicine at the University of Arizona. So that is my official position. I kind of do a couple different things, but that's my main one. As far as with the surgery club, I do feel that that's a very important aspect of what veterinarians do, and in this day and age, especially since veterinarians are allowed to do surgery on anything, I think it's important to do it responsibly. And so I felt that being part of the club was important, and I've always liked fundraising and putting on events, so I thought that this was probably the best position for me. At this event, of course, we can't be practicing on live patients by any means, and we also are in an establishment, so, it gives us a couple restrictions there, but we do have, what is nice is as any type of profession has evolved, we have suture pads, which are a skin-like piece that students can practice on to really get their technique down so that they can place sutures appropriately, make sure they're tight enough, not too tight. And what we put together here is we have first and second year veterinary students, which is kind of nice. So we have some that are a little bit more advanced and some that are just beginning to learn, which is kind of neat. And then we have 4 of our professors here with us this evening. And so they'll be able to kind of give some good technique pieces, some good kind of like fine-tune pointing for a lot of the students, and that'll be a good thing for a lot of the first years. For some of us second years, because we've kind of taken that next step, it'll just be really about picking up some kind of best practices and things of that sort. But it's really just to help kind of fine-tune, again, get some of our students together, a good mingle, if you would, because again, that hasn't happened a whole lot because of the, what's happened over the last year. So it kind of twofold, a little social and also a little learning.
My name is Ariana Adams. I am a graduate veterinarian student in my second year at the University of Arizona College of Veterinary Medicine. I am a part of the inaugural class of this college, so we just opened about a year ago. I am the vice president of the surgery club, the student surgery club. I actually helped to create the club with the president. Since we are the inaugural class, our job was kind of setting up all of the clubs. As veterinarians, you can choose or whether or not you do surgery, but it's an important skill to learn. So surgery club's goal is to expose students earlier, before we start surgical rotations, to all the aspects of surgery: anesthesia, suturing skills, tube placement, things like that, just so that students have an awareness of what surgery is and what all it entails before we get that experience and that technical education. Personal goals for me is really just to get as much experience as possible. I really want to be able to go into my surgery rotation, which actually starts next semester, feeling more confident with the aspects of surgery and feeling confident in my skills as like my suturing skills, because that's a big part of surgery. So it's really just to gain confidence and a basic knowledge level before actually starting the physical aspect of learning surgery. We started in COVID, so COVID has been very rough on the entire school and all the clubs, but this year with a second class that we have intake now, we've gained a lot of members. We're building up our financials, and we're able to get more participation and more exposure to everybody. So it's really nice to not have all of my class spread thin. We've got more people that are invested and interested in doing things, and we're actually able to get that hands-on experience with the students. We just conducted a wet lab yesterday where a professor of ours got us some horse legs and some intestines, where we could actually practice our suturing skills on them, just to get exposure to what does fresh tissue look and feel like when you're suturing, because it's a lot different than the practice pads and things that we have. I'm just looking forward to being able to perfect my personal suturing skills, but also just expose the other students and look for other ideas. We'll be transitioning over to the next class as we start surgery, because we're going to be very busy, and then we start clinical. So I'm just looking forward to see the club progress and the different ideas that come in as more classes come in.
And so this is a casual event, because in a classroom setting and in the lab, it's a very different feeling. And so the students want to get together, and it's called sit and suture because they can come out and it's in a relaxed, it's in a, where we are now, in a restaurant, and you can sit back, you can have a nice meal, drink, whether it's a soda or other beverage, whatever it is. And there's several clinicians like myself that are here, and as they're putting these, they're working and practicing on these little patterns, we can work with them in just a casual setting giving them tips and tricks and advice and things that we've seen, share our.
I mean, if you are like a pre-vet medicine student, and you ever want like advice, I think that we as a college and as students are definitely open to being mentors and reaching out to us. I don't think is ever a problem just to ask questions about applying and things like that, but we really just like once kids are in to the program, we really want to get them exposure as soon as possible.